So what is scalp advancement? So scalp advancement is one of my favorite procedures. It's good for women who have a very high hairline. And so, some people call it their 5 head because their forehead is so big. They may have been made fun of as they grew up, which is really sad, but it happens and I've heard it quite a bit. I don't generally do scalp advancements on men who are not on any sort of estrogen supplements because the hairline can keep receding over time. But in women in general, the hairline stays pretty stable. And if there's ongoing hair loss, I'd really want to know that beforehand. A scalp advancement is done through an incision right in the hairline, and that allows me to bring the scalp forward. And the amount of lengthening that I can get depends on the person, but I can get to up to 2 inches even with my technique that I use. The stitches remain in place for 1 week and I take that out, and after that time the incision can stay pretty raw. So what is recovery like after scalp advancement? Well, in general, recovery is not too bad. I've had patients, go back to work at home in 2 to 3 days because there's generally not a lot of pain or swelling. I don't tend to see the swelling around the eyes like I do when I'm doing bony work. So you're left with an incision right in the hairline here that you have to keep clean. I really want you to wash your hair and put ointment on the incision so that it doesn't get crusty. Any kind of scabs that form can, widen the scar. As long as you're taking good care of the incision, it generally heals very well. After 1 week, I take out the stitches, and occasionally I need to put in a reinforcing dissolving stitch, but it stays raw for an additional 2 to 3 days. At that point, I still continue ointment on the area. And once that heals over, you can change to just sunscreen and any kind of makeup to cover it up. As long as you're using good concealer to cover up the incision, it's generally not visible after a couple of weeks. Although if you take your makeup off, you'll still see a pink line that will be present until it lightens over time. And everybody's a little bit different in the time frame for that. After a few months, you'll start to see hairs poke through that incision, so it will camouflage it even further. Most of my patients don't have a lot of pain after scalp advancement, but you will have some numbness of the top of your hair and a little bit of tightness for a few days, which most people take Tylenol and ibuprofen and really don't need any other pain medicine. The numbness can last a while, so during that time I just have you use the cold setting on a hair dryer instead of the warm setting because you don't want to burn your scalp. Those are just modifications that I'll tell you in your post-operative visits. And another trick that I like is the way you brush your hair afterwards. So I'd have you hold your hand over your forehead and brush forward. And that's because you don't want to put any tension on the incision. Any tension on the incision can widen it. So for the first few months, we want to do everything we can possible to not put tension on that incision. Most of the things are really small like that and changes of your day-to-day life, but over time you go back to completely living normally. So.